Guys, we're in the middle of a pandemic and these are trying times. It's hard on our mental health, our mental state, and this is why I love our sponsor today, BetterHelp. They're the largest online counseling platform worldwide. They change the way people get help with facing life's challenges by providing convenient, discreet, affordable access to licensed therapists. BetterHelp makes professional counseling available anytime, anywhere, through a computer, tablet, or smartphone. It's brilliant. Sign up today. Go to betterhelp.com/solvinghealthcare and get 10% off sign-up fees. Welcome to Solving Healthcare. I'm Kwadwo Kyeremanteng. I'm an ICU and palliative care physician here in Ottawa and the founder of Resource Optimization Network. We are on a mission to transform healthcare in Canada. I'm going to talk with physicians, nurses, administrators, patients and their families because inefficiencies, overwork, and overcrowding affects us all. I believe it's time for a better healthcare system that's more cost-effective, dignified, and just for everyone involved. Quadcast Nation, we are back, and we got Dr. Ari Joffe and Dr. Matt Strauss. Why? Because these guys have been advocates for the harms of lockdown, talk about the secondary implications, the unintended consequences, and we want to address that. And I'll tell you my motivation. You know, I recorded this on March 10th, and I still have this worry that weeks from now, we'll be talking about further restrictions. Are we going to be locking down for increasing cases despite vaccinations and so forth? And, you know, I honestly think that's a mistake. And this is my attempt to make a case for it, where we really focus on areas that are of concern, do our best to address some of these secondary negative impacts of lockdowns and really make a case on why we should have more targeted approaches. And I know that not everyone's a fan of this, but I'm honestly, I'm pushed by my kids. I saw how these lockdowns impacted my kids and potentially could be impacting generations from now. And there's been areas in the world that have, for example, not been in school for over a year. I mean, that's not benign. Just a couple housekeeping things. Sign up for our newsletter, solvinghealthcare.ca. Our newsletter where we get our latest and greatest content, latest shows, upcoming guests, health tips. It's the money. So go to solvinghealthcare.ca and sign up for that bad boy. You won't be disappointed. Okay. So without further ado, we're just going to jump into it. Harms of Lockdown with Dr. Ari Joffe and Dr. Matt Strauss. Quadcast Nation, we decided to get some great minds together. Okay, because we are once again talking about lockdowns, the manifestations, what happens as a result, some of the unintended consequences, because as you know, this is part of the underappreciated story with COVID. So we brought some advocates in the mix. We got Dr. Ari Joffe and we got Dr. Matt Strauss. Gentlemen, welcome to the podcast.
Thanks for having me. Thank you for having me.
100%. So Ari, first of all, you're from my motherland, aka Edmonton, which I got to give some love to my Oiler Nation out there. But you've been actually pretty vocal since I want to say from the beginning about your concerns about us locking down and some of the secondary consequences. What spurred this on, and like what is really pushing you towards being such a voice?
Oh, that could take the entire podcast to explain.
Might cut you off, but here we go.
Well, lockdowns. At first, I thought lockdowns were the best option, and my kids, who two of them are in engineering, so they like to analyze things, and they kept asking me questions about them, and I kept looking into it. And I realized that I think like most healthcare workers, I was focusing on only one thing, and that is COVID, to the exclusion of everything else. And being trained in critical care and infectious diseases, I am not trained in making policy decisions and trade-offs, emergency management. I was focused on COVID alone. And also some of the initial data that was coming out was very misleading, including the modeling and forecasting and the case fatality rates and the ways that countries were trying to control spread. So all of that was, I think, misleading. So what I think changed my mind were two things. One was looking into what the infection fatality rate is as opposed to case fatality rate. As data emerged that there are probably at least 10 times more infections than detected cases, and the infection fatality rate was very low until there seemed to be an inflection point in that infection fatality curve around 65 to 70 years old. And that was also compatible with the high-risk groups being by far by age. Those 70 and older and those 60 to 69 with multiple comorbidities were at high risk. And other people, it looked like the infection fatality rate was going to be overall in those less than 70, as John Ioannidis showed, 0.05%. So that made me think, why are we locking everybody down when we should really just be protecting people who are at high risk of adverse outcomes? The other thing that swayed me was reading some work by an economist in London, England, called Paul Fridgsters. And he was writing that the economic recession can easily be predicted to, in the long term, cause far more deaths and loss of population well-being than the SARS coronavirus 2 virus and COVID possibly could. So that lockdowns causing an economic recession would cause far more harm than benefit, even if it was 100% effective at preventing spread of the virus. And on top of that, there was data coming out that was questioning how effective lockdowns were anyways. And I think the efficacy of lockdowns has been, at best, highly exaggerated. And they're not as effective as we think, which would put the cost-benefit analysis even further in favor of no lockdowns. I guess the last thing was lots of other collateral damage occurring, right? With delayed healthcare for other reasons like cancer screening and diagnostic tests and school closures. I'm a pediatrician, so that has huge effects. A loss of schooling will result in loss of potential future earnings and future lifespan and development of all these children. And the effects on the developing countries were even more alarming, with many millions projected to go into poverty and food insecurity and tropical infectious diseases increasing. So it just became clear to me that lockdowns were clearly the wrong approach to responding to the pandemic.
Yeah, and you make a lot of great points in terms of, why we really need to think about such a massive weapon, as opposed to thinking about some more strategic strategies. Matt, what was your story? Actually, I still don't know your story about why you started to be such an advocate for the harms of lockdown.
I think it's a little bit accidental, and maybe my story is a little bit more personal in that I got married on March 14th of 2020. So my 1 year anniversary is coming up in 4 days. I better not forget. Anniversary. Yeah, and I don't think I will forget. So it was about this time last year, the final preparations were going down, and a worldwide pandemic was called. And so my wife's also a physician, or my then fiance, we're trying to figure out if having our wedding was going to cause our grandparents to perish, basically, and our loved ones who are elders. So, and of course, we were getting anxious messages from even our bridal parties. So I spent, I'm not exaggerating to say I was spending 10 hours a day on PubMed or MedRx, however you pronounce the name of the preprint server. There was a shining moment there in mid-March where I honestly thought that I had read every paper that existed on COVID-19, because I was trying to figure out whether I needed to cancel my wedding to save my family. And if we canceled the wedding, I honestly did not know how I would pick my wife up off the floor, because she'd been planning it. She'd done the lion's share of the work. So we had the wedding. I always thought people were flattering their spouse when they say it's the best day of their life. It was literally the best day of our lives. And we just basking in the afterglow afterwards. I was like, I can't believe we almost missed the best day of our life up till this point. And so that's how I felt like I knew everything there was to know about it. And I had formed some opinions, and I thought, I'm going to start sharing them. And I had done this fellowship in journalism, and I had been publishing in like the National Post and Vice News previously. So I wrote a piece about, maybe lockdowns have a place, maybe for a few weeks. Maybe we should start letting young, healthy people out in the, 2 weeks from now. And that piece was published in The Spectator in the UK. And then it kind of all snowballed from there.
And just out of curiosity, did you get a lot of heat initially for your point of view, or how did that turn out? Initially, no. I would say I got an email from a hospital administrator saying, you ought not to do this. And it's maybe inadvisable for me to say this, but I'm affiliated with a few institutions. I work at a few places we've talked about before, so I don't want to throw any particular institution under the bus or bring disrepute on anyone. But I kind of flipped out when I got this. I called the CMPA, and the physician advisor literally laughed. Like they thought it was hilarious. They looked at my piece and they were like, "No, this is all couched in science." Mm-hmm. You have every right to do this. And so I sent a polite email back saying, well, we're in a very serious predicament here, and we need experts to be able to speak freely about what they're seeing and what they're thinking so that we can come up with the best public policy. Like we're not going to, you don't get better decisions by shutting down debate and discourse. And so that was respected. I will say the heat turned up months later, kind of in November, December. I was fielding more emails like that, but I think my position largely hasn't changed, that we all need to be speaking openly and honestly and with kindness and compassion. But we're not going to get change. We're not going to get the best policy possible if we're not hearing every perspective. Oh man, this is the part that I thought was the most alarming about the initial, like especially in that first wave. Like you couldn't even use the term seasonality. I feel like that was something controversial. You mentioning some of the secondary consequences of lockdowns was controversial. It was all about stay home, and that was the only acceptable message. And I that part to me was one of the most alarming. And like Matt, I'm assuming you said you're about 8 years into practice, eh? Like is that fair? Yeah. So yeah, that's right. You there's a certain stage in your career, you still feel you're walking on eggshells or what have you. So especially getting notices like that. But what from maybe I'll go to Ari. Like, what was the most impactful in your mind? Like when we think about the harms of lockdown, like what got to you? Like what was the like maybe even stuff that you may be seeing in your own life or in your professional practice, but what was the components that was like to you, like, this can't be ignored?
I don't think there was any one thing. I've realized for some time that I'm in a very privileged position. And, I'm a physician and I work in the PICU. I had a guaranteed job. Everyone couldn't go to work. I got to work mostly from home, go in to be on service, still get paid the same amount. I mean, if anything, I was not working as hard as before the pandemic. So I think hearing what was happening to people in less privileged positions and to how the effects of lockdown were magnifying inequality and extremely harsh on people who already were disadvantaged. That was something that made me realize that these collateral damage effects need to be paid attention to.
What about you, Matt? Did anything kind of stick out, or was it similar to Ari, just kind of like several things that just felt like needed to be addressed?
A few things stick out. So one thing that I saw in 1 week on service doing internal medicine, I personally admitted 2 elderly women, both of whom were starving, like admitted to hospital with starvation. They had ketosis and low albumin. And so the one, she was at a retirement home, and she was kind of had some mild cognitive impairment such that she wouldn't really remember to feed herself. And her family had been coming to the retirement home to feed her. It's not, as you know, I don't know if listeners do, but retirement homes don't feed you, nursing homes do. So when her family was banished from the premises in the name of social distancing, just nobody fed her, and she just wasted away until and I'm again not saying this to disparage the retirement home. They're not set up to do this sort of work. But you take away those essential family connections, and this elderly woman presented starving in Canada in 2020. There was another woman who she was in a nursing home, but she just started refusing to eat when she couldn't see her family. And she also presented starving. And once she was refed, she was transferred to psychiatry. So those 2 women, and seeing them in the space of a single week, stick out for me. One is another in kind of more personal terms is one of my wife's best friends just got hired as a pilot for Porter. And a few months into the pandemic, he was bagging groceries. And I don't know why that, like, I know my dad's an airline pilot, and I know what goes in the amount of training they do and the hope and enthusiasm they have, and to have your career just whisked away from you. He's in his late 20s, and he'll bounce back, but that was hard to see. Another is a physician I'm very close to had to tell someone because of I would say, I think, over excessively restrictive hospital visitation policies. I'm sorry we didn't let you see your wife the last week and a half. She passed away suddenly. And that person I'm told wailed like an animal, like a wounded animal on the phone to hear that. And I don't I don't know how to attach a statistic to that kind of suffering. Sorry if that got a little bit dark, but really affected me.
That shit is dark. That's the thing, man. Like I still will never forget an elder patient, literally beautiful person, like just like gave to the community, big family, the matriarch of the family, dying alone, not only because of a mix of the visitation policies, but also how fearful people were to come into hospital to see them. And I'm like, there's something we're messing up with this messaging. And then the other thing for me too, that was, I think we failed people a ton, was the late presentations that were coming in that first wave, like late presentation MIs, late presentation strokes, like totally salvageable, conditions. But people out of fear were just like, I ain't coming to get no COVID in hospital.
I have a happier story that makes the same point, which is my wife and I were barbecuing in the summer, and my next door neighbor came up to me. He said, "Hey, can I talk to you for a second?" And his mother tongue is Korean. He had this like medical translation app, and he was like, "What is this?" And it said myocardial infarction. And I said, "It means you should go to the hospital." And I was like, "What's going on?" He was like, "I get chest pain when I walk." And I said, "Well, you need to go to the hospital." My wife was also saying the same thing, and he was like, "Is there COVID there?" And I was like, "Actually, no, there's actually no COVID at our hospital today. Like, you need to go to the hospital." And they were like, "Is there parking?" And I was like, "Yeah, there's ample parking." They were like, "Is the parking free?" And I was like, "Get in my car, just get in my car." So I drove him to Emerge, and I dropped it. They wouldn't let me in. And they hooked him up to a monitor, and they admitted him with unstable angina. He had a STEMI that night, and but he was absolutely petrified of going in, and he got a cabbage the day after. So Same point, but I felt like because I was being dire earlier, I should tell a happier story.
That's an amazing story, to be honest with you. The parking though, you know what I mean? Like, yeah, it's just funny. It's just like, but that's the one thing. I don't know if you've appreciated this too, Ari. Like I don't know if we've really expressed risk. Like like, for example, I think people say, for example, you're in your mid 20s or whatever. I heard the stat that, and I could be getting this wrong, but there was a significantly, like, I want to say 20-fold times more likelihood of you dying in a car accident than you would be from your COVID, and from acquiring COVID and dying from COVID. And because of the messaging, I think this was something that was completely lost. Like, it's not the same when you are 72 with type 2 sugar diabetes, but if you are a 23-year-old healthy individual, like, it's not the same. I don't know if you found any inconsistencies in the messaging.
Yeah, I think, you know what, the messaging has been that we're all in this together, and that's a bit misleading, because I get the impression that the public thinks this virus is deadly, that if they get COVID, they are going to die. I know my mother-in-law was telling my wife that if she gets COVID, she knows she's going to die. And I kept saying, well, no, even though you're in your 70s, you still have at least probably 95% chance that you will survive. But if you're in school and 10 years old, your infection fatality rate is 0.001%. It's far lower than from influenza every year. And even in people under 50, the risk seems to be lower than the infection fatality rate from influenza, and people don't know that. So yeah, people are scared to go to hospital, and they're petrified that they're going to get this. And I think the fear is far out of proportion to the risk in most people.
Yeah, it's wild. Like, I honestly, I think if I were had the time and the bandwidth, I would have like a COVID risk app for people. Just be like, yo, plug this in and see what your legit risk factors are for acquiring this. And like, it's we all have to do our part to, like, not propagate the COVID and spread it to people that you don't want to get COVID. But also, I think there's consequences of being too fearful that we're exactly what we're talking about. So, like, Matt, like, what if you had the authority to change things? So, like, what are the main kind of approaches or changes that you would have liked to have seen during different parts of this pandemic?
I think what Ari was driving at, we understand that the risk is different to different people. And I think that the Canadian public, but also public health establishment, is nuanced enough to make this sort of tailored approach and to focus protection on the people who needed it the most. And we haven't done that. We spent $450 billion on the pandemic strategy that we chose, which involved paying 16-year-olds $2,000 a month to watch Netflix in their basement and not go out. We could have taken all that money and built absolutely ironclad nursing homes.
Word.
$450 billion, for reference, it would be enough to build 2 brand new hospitals in every city in town in Canada. So it seems like an extraordinary, and we know this from other areas of public health. Like we don't give HIV prevention medications to every high school senior at prom night. We HIV prevention medications are amazing. They're life-saving. They've done so much to reduce HIV, but they're generally prescribed to people who are in very high risk categories. So by and large, that's what I would have liked to have seen. I would have liked to see tons of resources. Like, COVID is a serious illness. I've seen it kill people, but we could have saved so many more of those lives by focusing our efforts on the people who we knew back in the spring were most likely to die. And that's what I think was missing.
143%. It still baffles me how we haven't focused our energies on the truly focused our energies on the high risk areas. Like long-term care, the gift has been the vaccine at this point. Mm-hmm. That's what's going to save that scenario. But there's still going to be the understaffed IPAC, I'm not sure IPAC levels at each nursing home is going to be up to what we call standard. I think a lot of places are making some modifications to ensure that PSWs aren't going to multiple sites. But man, like we really the vaccines saved that environment, but we still didn't deal with essential workers, multi-generational homes, other areas where we think that are the major sources of spread. We just decided to go, we're going to go heavy-handed on everybody and see what the results will be. Can
I add one other thing to my answer?
Yeah.
My other major interest is philosophy, and I hate to use the word, but morality. And I just think we're at risk of losing the essence of medicine when we make pronouncements on the order of commands to folks that you must stay home, and your job is non-essential, so we're canceling your job. And in my practice, I'm very sensitive to issues surrounding informed consent, and I don't think that Ontario modeling data or today's daily COVID case count can tell you whether your father's funeral should be canceled or not. I think the way we build value in our lives, the things that people find meaningful, cannot be captured in those statistics. And so it was a real, I don't want to say breaking point for me, but it was a really, really hard day for me when Ontario was playing maybe we will, maybe we won't cancel Christmas. And I thought that, to people in different communities and different parts of the province, Christmas means different things to you. And it's not I don't think for the government to say whether it's on or not based on statistics. I just really fear that we're moving away from a medicine that is grounded in individual values. So that's another thing that's caused me a lot of concern over the last year.
Yeah, I feel like the value. I didn't think we had a situation to express our values. Like for me, my line in the sand when I got my big boy pants on was when they started to affect my kids. When I saw that they were starting to do some bullshit, closing schools, like in Ontario, like where I live in Ottawa, when they decided to reclose the schools, we had 3 patients in ICU in a city of 2 million. I was like, nah, this is ridiculous. No, my kids' education, my kids' well-being, no, gloves were off at that point. You know what I mean? Like that was kind of like and I feel like a lot of Canadians, at least when it comes to their kids or the youth, this is where they get, or at least for me, this is when I was getting uncomfortable, knowing that our impacts cannot just affect them directly right now, but could be generational. To me, that's when it just got to me. And I said, this is unexcusable. And I because everyone's got their tipping point. And when I think, when I'm gone and these guys got to live their lives and they can't afford a house, they can't own a house. They're still paying for the mistakes we made. I just was like, we could do better. I don't know, Ari, if that you felt something there too.
Well, if I can, I will tell you what I think should have happened, and I'll be blunt because not being blunt hasn't worked. So I should have said the quote I was looking for is that Theresa Tam wrote in her report on public health in 2020. The main quote is, "No one is protected until everyone is protected," and that is just plain false. And to me, that shows that public health should not be in charge of a pandemic. And a pandemic is a public emergency. It's not a public health emergency. A public emergency means it affects every sector of society, not just the healthcare system. And that's why the mistake was to give the response to the medical officers of health. That was a big mistake, because the people trained to manage a public emergency are the emergency management organizations. Every province has one. They helped write the pandemic response plans, and they know that in a pandemic, the goals are not just mitigation, but they have to ensure critical infrastructure is ready for people who get sick, and they have to maintain the economy, and they have to maintain life as normal as possible. And unfortunately, public health, like being medically trained, we're focused on COVID alone. They are not trained in making trade-offs and policy decisions. And emergency management is. And I've been talking a lot with an emergency management expert, David Redmond, who is ex-military, and he was in charge of Emergency Management Alberta and in charge of Canada's counterterrorism after 9/11, and has many other experiences. And hearing him talk about emergency management principles and the process showed me that, yes, he's right. Medical officers of health are not trained. So the way it's trained to respond to a public emergency. And what the agencies involved, there's public health has to be involved. And what they should have been tasked with is how to protect long-term care homes and how to get hospital surge capacity, including ICU surge capacity. And surge capacity does not mean canceling healthcare for everything else. It means being able to manage a surge without canceling healthcare for everything else. And and protecting long-term care homes, the best way would be to quarantine them. Right now, the entire society has been quarantined with hard lockdowns. And this false claim of circuit breakers that were supposed to last 2 weeks and instead last for several months, they're lockdowns. And quarantining long-term care homes would mean quarantining the patients and the staff, and they'd work a month on and a month off, and long-term care homes would be protected. And having adequately paid staff that are trained in adequately trained. So we could have done far better with long-term care homes with an emergency management response, because the first principle of mitigation is to remove the vulnerable people from the risk. And we knew right away the vulnerable people are older people, especially with comorbidities, especially 70 and older, and especially in long-term care homes. And in the first wave, that was over 80% of the deaths from COVID. And then we had 4 months to prepare a better strategy for long-term care homes, including quarantining them. And even older adults in the community could voluntarily have quarantined with voluntary caregivers at home, or we could have made long-term care type facilities for more vulnerable older people to live in at the highest risk time. And I like where you're saying $400 billion could have created these hospitals. You know, the Justice Center for Constitutional Freedoms has a quote in their paper where back then it was far less than 400 billion that had been spent, but they said in the first wave, for that money, we could have put every single older person in a 4-star hotel with a personal attendant, and it would have cost less. So I honestly think that it should have been an emergency management agency in charge, and the messaging should have been who is really at high risk, how are we going to protect them, how are we going to maintain the economy, How are we going to maintain life as normal as possible, including kids going to school and not disadvantaging people who are already disadvantaged? So I think that, the focus on lockdowns was misdirected. And in fact, even in October 2019, which is quite a coincidence, 1 month before COVID-19 broke out in Wuhan, WHO updated their pandemic response plans. And they said quarantine should never be used, period, in any pandemic. That's in an influenza pandemic, even as bad as, if it was as bad as 1918, they said quarantine should never be used. And then the first thing used has been quarantine. So nobody went by the previously well thought out pandemic plan.
Yeah, I mean, a lot of decisions, I don't know if they're emotional, but they were certainly fear-based. But you bring up a point that I've always bothered me, even from a public health perspective. My concern was always been it's public health, all aspect of health, not public COVID. You know what I mean? And so, like, we were it's right now it's March 10th, and the government of Canada put out access death document that neither of us have dived into in any detail yet. But the point is that there's been some excess deaths related to secondary impacts of lockdowns. But this was a thing that always bothered me. It was that we weren't doing anything to kind of address some of these secondary risks, even like the mental health. Like, imagine that some of that 450 million was free mental health services for Canadians. Like, you know what I mean? Like, something to show that you're at least addressing some of these areas of concern. And there's something that the three of us have that is a bit, I don't know, say unique to a lot of the experts that you're seeing, is in our daily jobs, we have to always look at things holistically. You got all these lovely consultants that will say, you know what, you need to dry the hell out of those lungs. I'm going to dial up that dialysis, please. Or, as per the cardiologist, or the nephrons telling you to give more fluid. Like, you're always balancing the multiple opinions and perspectives of the experts, but ultimately you're trying to do what's best for the patient. And this is the perspective, like, it's been like, what is going to be the best for everybody? What's the solution that's going to be the best for everybody? And one of the match points was, in terms of these like models and stuff. I'm like, one time I just want to see the modeling for, I don't know, cancer deaths from delayed diagnosis or delayed surgeries or overdoses that we're seeing. Add that to your bloody model instead of just showing this exponential curve that's never been close to right. You know what I'm saying? And
exactly.
And people making decisions based on these crazy models. You know what I mean? Oh my!
The forecasting has failed every time. The forecasting has failed. John Ioannidis wrote a paper on that too. That forecasting has failed even for next day numbers. The models are not accurate. And anyway, I have to apologize. Maybe I got a bit heated there.
No, that's good.
You had to bring it back down.
No, that's good. This is what we try to keep it real on the Quadcast. You know what I mean? It's good. People want to see emotions from physicians. You look like you were going to say something, Matt, but maybe I'm just reading.
Oh yeah, no. I mean, I think we're really going to have a good think after this is all over about what is the place of modeling in a totally new situation, in a totally new emergent situation, because as Ari mentioned, almost all of the models failed in retrospect. I remember finding it straight. Like I'm interested in modeling. Like I like math, and I'm interested in what they do. Some of the models, well, my best man and best friend is a math professor. He picked apart some of them. And there were kind of elementary errors made in some of them, so assuming that everyone who died of COVID would die in an ICU, and as a palliative care physician and intensivist, I imagine, ways that doesn't end up being the case a lot of the time. And I remember reading the modelers' papers and I just found it bizarre that they're putting their predictions in the results section. And I'm like, this isn't a result. This is a prediction. Like, the result is 2 months from now when we see whether this happens. And so your model's not evidence. Your model's not evidence until it is validated by correctly predicting things. And then even then, there's philosophical concerns. So I'm really skeptical about a lot of things. And unfortunately, in my practice in ICU, just watching it develop over the last 10 years, that skepticism keeps being borne out again and again. Like most of the things I was taught in medical school about critical care have since been invalidated by a international multicenter randomized control trial. And I think we're just going to have to turn this sort of skeptical eye to modeling, particularly when you're shutting down people's businesses and canceling funerals and weddings and increasing rates of malnutrition in the developing world based on model results.
Yeah, that to me is what was kicking it, was like, yeah, you okay to be wrong. It's like you're a meteorologist. Like, I mean, if you're saying it was going to like be 15 degrees and it ended up being 12, like, okay, no biggie. But when you're like, yo, traffic can't come to this area, you guys can't leave your homes based on this, quit your job. You know what I mean? Like there was a lot of decisions based on this. Like, I mean, I don't know if you got a piece of this in Alberta, but we had, I think it was in February, like Ford coming on the mic being like, wait till you see these projections. You will go you'll shake in your boots based on these variants of concern. You will shake in your boots. Cases went down. You know what I mean? Like literally went in the opposite direction. I'm literally going on national news and I'm holding myself back saying like, you see, you guys were getting all hyped up about this. They're going down in cases. You know what I'm saying? Like, I don't know. That's what was killing me.
So not to pick fights, but so I think Dave Fishman's on the record on his Twitter saying a tsunami of deaths are coming around that time. And Eileen Davila, the Toronto medical officer for health, went in front of television cameras and said, we're at the start of the third pandemic. This is the third pandemic. I've never been more scared. And again, it's okay to be wrong, but we need to learn from missed predictions.
Yeah.
One of the principles of emergency management is you can tell them that you're worried, but you don't tell all the public that you're deathly scared, because that tells them that you have no clue what to do. And what you need to do is have confidence in the response so people will listen. You tell them, now we figured out how to protect older citizens. Now we figured out how to make sure the healthcare system can look after you, so you can have trust in us, where you can say we're worried, but we can get on with the economy and our lives and stop all this devastation. That was one of the, I think, a bad thing to say you're deathly afraid of what you're seeing.
Can you imagine getting that message though? Like the confidence that would build I don't know. I get maybe it's I'm tired, but just I get chills just thinking about that public health message of saying, you know what, like we have confidence that we can handle this, and like this has kind of been, I mean, this on my platform, it's been the lens of positivity, what we can control, but just hearing that message on a regular basis, that's what I thought. I really liked Bonnie Henry, and when it came to like the overall kind of, I got out of all the public health leaders, I think she was the crown jewel when it came to how to communicate consistent messaging, simple messaging, controlling what you could control. But Ari, just hearing that kind of approach, like throughout the pandemic, that, having that vote of confidence. And the other thing that I really like too about kind of thinking about focusing on where the problem spots are, like from that emergency response, like when, like put most of your energy, like I'm a big 80-20 person, like big on Pareto's. Like if you know where the bulk of the problem is, put most of your energy where the bulk of the problem is, and you will see a significant reduction in all measures, death, hospitalization, and so forth. So those principles that you mentioned, because this is the first time I'm hearing this. I don't know if you've heard this emergency response. Like, I don't know if you've heard a lot about that, Matt. Like, but this is the first time I'm hearing about this avenue.
I think there were a few articles. Was it a Redmond? Was the
yeah, Redmond?
Yeah, I think he made a bit of a splash in the Alberta media around November, I want to say. So I saw a few articles where, yeah, he's extremely cogent. Obviously, has spent his whole career doing this, takes it very seriously, knows a lot, and yeah, I think I would have felt much more comfortable with him in charge of the response overall. And just in terms of being positive and uplifting, I thought there was a chance missed there where I think. When I was 18 or 24, or, I was constantly looking for opportunities to be a hero. And I think there's a whole generation who could have been called to be courageous and not even that courageous, because they're at very low risk of dying. And we could have said, like, here's how you can help take care of the elders in your community.
Wow. Yeah.
Here's how you can volunteer at nursing homes. Here's how you wear protective equipment so that you can not infect them. And instead, I just think the message of be very scared and stay at home was such a missed opportunity for I feel bad calling them kids, but for young adults to be heroes.
Honestly, I mean, I look back at. They're probably older than 18 to 24, for example, but people were looking to serve. Like I was even thinking about some of our trainees that we went through a run in March where, because of the people were coming back from vacation, and so they had to quarantine for 2 weeks and all these kinds of stuff. So we were down residents big time. Like it was just bad kind of coincidence. And the amount of people that were willing to step up and in a new, this was March, April, when we don't, there was still a lot of, unknowns about the virus and the dangers to ourselves. Without hesitation, you guys need help in ICU, I'm going to step up. These are people in their 20s that, that had their full lives ahead of them, that were willing to do their part. And so hearing that too, just that whole angle of what can you do? What can we do? I even think the messaging, what drove me nuts, this is the other time I think one of the public health complained about me. They're talking about masking outdoors and all this kind of stuff. And I'm like, this is ludicrous. Stop wasting your energy on this shit. It's a distraction. Tell people what they could do outside right now. It's December. Tell them they could go walk outside. They could play hockey at the rink. That's some safe shit. You know what I mean? And it's it's better for morale. It's better for their physical health. We've seen the risk factors for those that come in with COVID. Let's try and have that positive slant on it, and you'll have the faith of the people. If you really did actually need them to clamp down and bear down for a period of time, they'll be more engaged in it because, you have their trust. But man, double mask outside, you know what I mean? Jesus. Put on, you know what I mean? Do I need to wear a helmet when I drive too? You know what I mean? It's just getting, relax. Anyways, now I'm starting to get heated. But I just really, when I hear that positive messaging, that really, I think that would have served so many people so well in terms of what you can do.
Even what you're saying now, it would have been an opportunity to decrease risk factors. People could have been told, go outside, get exercise. The biggest risk factors to your mental health and from COVID will be reduced by getting exercise. But instead, sedentary lifestyles have markedly increased, even in children, because they're not allowed to go out.
Even in me. My fitness has plummeted over the last year, and I know the risk factors. So I remember thinking, and I put up some tweets about it in April or May, where I was like, listen, you're off work, everything's closed. Now is the time to learn how to run. I didn't necessarily take my own advice. I had a stressful year professionally, but I would have been so happy to see a kind of a root cause analysis and a real national. A paper came out recently, I think, showing that 2/3 of COVID mortality can be explained by metabolic syndrome, type 2 diabetes.
Absolutely. Just look at your ICU. I've had one patient in a year of this pandemic that they were older, but it maybe had not even pre-diabetes, but like was healthy, I think. Maybe one. And so many diabetes, pre-diabetes or straight up diabetes, obesity, like it was clear metabolic syndrome was a massive driver of what we're seeing. And I don't know if you noticed this too, Matt, but some of them had wildly difficult times trying to control their sugars while they're sick in the unit. I don't know if you noticed that.
Absolutely.
But yeah. And this, because to me, the lost opportunity too is like in May, June, July, when COVID was like, like really, hey, guys, you know, we're worried about a second wave. There's talk about second wave. Let's reduce risk. You know what I mean? Let's get out there, exercise, think about what you're eating, and just improve your chances of dealing with this bad boy. You know what I mean? But yeah.
They did do a bit of that in Britain. I understand they took the opportunity. I think they put some crazy amount of money into bicycle lanes. I think like $10 billion this past summer in Britain. I don't actually know if there were shovels in the ground yet, but that was I saw a few articles about that, and that was very hopeful to me.
Well, that's excellent. I mean, also, you know, those benefits go beyond COVID. You know what I mean? Like, you know, cardiovascular risks, stroke, cancer, like you name it. And environment, even when you're talking about making your city more bikeable, walkable,
social connection. Like you don't stop your car to talk to your friend, right? You might honk.
That's another one, by the way. Like people, I don't know. They're calling this, I don't know the term they're using, but people are having more awkward conversations now when they see each other because they haven't had to talk to people in a while. But like connecting again has been, I want to say a little bit more challenging because a lot of people haven't spoken to other human beings or interacted face to face with other individuals for years or months. Sorry.
That was on SNL a couple of weeks ago. They had a good skit about that where
really?
Two people who met up completely forgot how to talk to live people.
Well, my 2-year-old he's kind of in that predicament. Anytime he sees humans, he's just like, no. I'm gonna run. No, I'm just gonna straight up sprint, Dad.
I had an experience where I was talking to a learner in the hospital, and I think I said something. I sometimes have a dry sense of humor, and so I said something, and I was smiling broadly, but I was wearing a mask, so my eyes were squinted, and the learner looked at me and said, "I'm so sorry. I can see that you're very angry right now." And I'm like, "No, my eyes are squinting because I'm smiling so hard." And so who knows how many misconnections have happened because people think I'm just walking around the hospital very angry when I'm actually smiling.
That Dr. Strauss, oh man, did you see that look he shared there? Oh my goodness. No, I'm hoping we're not that far off from really starting to shed some of the restrictions. Like I think that it's huge that I think people don't really, this is another area where I think people were failing a bit is communicating the effectiveness of the vaccines. Like you hear them saying the efficacy is 68%, whatever, or single dose. But like when you're talking about reducing hospitalizations and deaths, like, wow, like this is where the focus should be and celebrated, you know.
Well, the thing I don't understand is proponents of lockdowns said lockdowns are to buy us time till we get vaccines. And now that we have vaccines and we're vaccinating all those in long-term care and older people, they're saying, whoa, you know what, we can't open up because we're worried about these variants of concern. They labeled them of concern. But like you say, even probably with variants of concern, the vaccines will reduce severe COVID hospitalization and deaths, even if they don't prevent mild cases. So we got, by a miracle, we got our vaccines, and it's still not enough.
I honestly, I don't know. Part of me wonders if, at least the fear mongers, sometimes I feel like they just want to stay relevant. Do you know what I mean? Like if you're an epidemiologist that's been getting attention for a year, you're about to lose some love soon, man. This, you know what I mean? Like you're hanging on to getting, those news agencies aren't going to be calling as often. Those media agencies aren't going to be calling as often. Cause I honestly, I don't see how we can't be optimistic right now. I don't get it. I can understand why news agencies want to like more headlines or whatever, you know what I mean? Like, oh, there's a new variant in New York or whatever. But like, if we're talking the big picture, getting out of this pandemic, man, having those vaccines is massive.
Well, and if it's not the vaccines, then what is it? Like,
exactly.
Literally, then what? Then we just lock down forever? And I humorously, I have a member of my extended family, let's say, who's anti-vax, but pro-lockdown. And I'm like, well, so we just lock down forever then? Like, if the vaccines aren't the answer, then like just let me take my lumps. Like, there's only, or this is another argument I made. It's just from a utilitarian perspective. Like, suppose we all live 100 years, which we don't, and suppose the mortality from COVID is 1%, which it's not. How many years would you spend in lockdown to not get it? And like the math, it ends up being 1 year. That's kind of the pot odds of how long you would spend. But it just starts to not make sense to not live your life at some point. And we have to, if that point's not the vaccines, then I don't know what to do. I don't know what to do for you.
Yeah, exactly.
And that's assuming two things. One, that lockdowns work, which they do not work nearly as well as people have been claiming, many studies have shown. And two, that they'll actually be of benefit to them in terms of their lifespan. And the evidence again shows that that's false too.
Oh yeah, no, I'm giving them those premises. Just because I've been arguing those parts for a year, and I've not much fight left in me on those points. But if and I can understand. So I've had one dose of the vaccine, which I mean 80-20 rule is most of the benefit already. So I can understand how it would seem unfair if I got to go to the Caribbean now and I got to take off my mask and while other people are waiting. I can see that there would be some hard feelings if I had special privileges, let's say. But that's just an emotional argument, though. There's actually not much of a reason that I need to have travel restrictions and not wear a mask. Statistically, like it's quite improbable that I'm going to get COVID or give it to anyone at this point.
Absolutely, and. Like I was asked the question, when do people get to hug their grandparents when they get the vaccine or whatever? I'm like, literally, you ask yourself, what more do you want? What more do you want to be able to make this happen?
And not to be dire again, but you're not always going to get to hug your grandparents. Like there is a finite number of times that you have the option of hugging your grandfather, and that's not forever. I think we all know that, given what we do for a living. 100%.
That is a very good point. And it also ties for me to that argument about risk, like the cost benefit of a lot of our actions. Like if I'll say this, like if I'm 83, 86, whatever it is, the idea of not being able to connect with my family or my grandkids for extended period of times, like I want that. I want an option to be able to make that decision, because there's value in that. You know what I mean? There's value in having that connection of being with your loved ones, and I just think that part was kind of forsaken in all of this conversation.
So I actually had this conversation with my grandfather the day before my wedding, because I wanted to explain to him what his risk was, but given all the reading that I'd done, and that I wouldn't be offended if he chose not to come. He was offended that I asked. He was like, I wouldn't miss it for the world. And he meant that. He's a very smart man. He knows what COVID-19 is, and he understood the risk. But he was in a position prior to the lockdown to make the choice for himself, and that's the choice that he made. There was this terrible, terrible article about a 92-year-old woman who chose medical assisted dying rather than go through another lockdown. And I really worry that we're not, maybe I'm repeating myself, we're not taking individual values into account when we tell someone we're locking you down in your nursing home and not letting you see your family for
You
your
absolutely
own good.
did not.
For your own good, we're putting you in solitary confinement, and that's not medical ethics as I understand it.
Oh man, you imagine like some of them are half blind or half deaf. You can't watch, like you literally are doing nothing in a room for weeks. Like that's torture.
Yeah, the life expectancy for someone admitted to a nursing home in Canada is 18 months. And so if you tell them we're taking 12 of those months and not letting you out in order to make sure you get the last 6 months, I don't think that's a deal I would take. And I don't, and maybe some would, maybe some wouldn't, but we didn't ask.
Yeah, we didn't ask. And I know personally, there's no way I would take that. And my loved ones, when we talk about it, there's no way they would take that. You know what I'm saying?
I should clarify, when I said quarantine long-term care homes, that means one, voluntarily, and two, with adequate facilities for visitations, even if there has to be an amount of social distancing during the visits. But yeah, I agree that right now we're taking away people's charter freedoms. And the charter says that can only be done if there's due diligence to prove that it's the only option. And due diligence means a cost-benefit analysis, and that was not done.
Amen. Amen. Team, I just want to thank you for this amazing discussion amongst, I want to call it like the great minds of critical care and infectious disease. Guys, this was honestly, it was informative. It was inspiring. Makes me glad that we are doing what we can to advocate for, doing our piece for advocacy for sure. But yeah, thank you, Ari. Thank you, Matt. And hopefully we'll have you guys on again soon.
Love to. Thanks for having me. It was awesome.
Absolutely.
Thanks a lot.
Quadcast Nation, thank you for listening. I really enjoyed that conversation with Ari and Matt talking about consequences and the harms of lockdowns. And I just, I think it's an important conversation so we learn in the future. I think it's important to be able to approach these things in a more holistic fashion. So we're going to keep bringing up that content as much as needed, really. But hopefully we're on the better side of this thing. Leave any comments at quadcast99@gmail.com. Follow us on Instagram, YouTube, Twitter at Quadcast. Leave that 5-star rating. You know what I'm saying? Leave it on iTunes. It helps with the visibility of the show. Leave a comment there as well. And guys, thank you so much for the support. We feel the love, and it's all about just changing that boogie, yo, for real. Have a great rest of your day. Peace.